Air travel hit another pandemic record over the Easter weekend. TSA reporting that 1.5 million people passed through their checkpoints on Sunday alone. That is the highest total we have seen since March 12th of last year. This comes as the CDC eases some travel guidelines for people who have already been vaccinated. Let's bring in Dr. Brian Garibaldi. He's Johns Hopkins Biocontainment Unit Medical Director. Dr. Garibaldi, always good to talk to you. I will tell you, as somebody who traveled this weekend, I have never seen the airports as well as the planes themselves so packed since the pandemic began. What's your read on the latest easing of the restrictions from the CDC, and how comfortable are you with that, given how many people have been vaccinated, but also the variants that are still out there?
Sure. It's good to be back. I think the current recommendations reflect the fact that the real world data we're getting on vaccine effectiveness suggests that it's highly effective even with some of the variants that are circulating right now. So for people who are fully vaccinated, and again, that means 2 weeks after either the 2-shot series for Pfizer and Moderna or 2 weeks after your single shot for Johnson & Johnson, the risk of you getting symptomatic COVID is very, very low. It's not zero, though, and so I do think the recommendations also recommend that if you are going to travel, you want to take appropriate precautions, wear a mask, and still consider avoiding essential travel at this point. We're doing really great with vaccines. About 32% of the country has been vaccinated at least with one single shot, and so I think we're at a turning point, hopefully over the next few weeks. But we're also seeing concerning rises in cases in a number of states. The majority of states across the country are reporting a rise in infection, and we're also starting to see hospitalizations go up in certain areas, which is concerning. So we're not out of the woods yet. And when I see the numbers of people who've been traveling, I do worry that the majority of those people probably weren't vaccinated. And I think we're in for a little bit of a rough patch over the next few weeks based on the number of people who are traveling, the holidays that are coming up, and the surges we're seeing probably due to the variants.
Yeah, and Dr. Garibaldi, it's interesting because you kind of pair the weakening or change in guidance from the CDC for people who have been vaccinated, compare it to maybe cruise lines not requiring vaccinations for travelers, and where we sit in this kind of reopening standpoint here, because I guess it's at a certain point you want to stress that it's better to get vaccinated, and the CDC would obviously be trying to tell Americans that. But how do you kind of find the middle ground that is appropriate in getting back to normal from a public policy perspective in your mind, given what we know about the virus now?
Well, I think it's going to be interesting to see what particularly those in the travel industry do in terms of requiring vaccinations or proof of vaccination. Obviously, this is a hot topic, thinking about whether or not we're going to have vaccine passports for certain activities. There are a lot of potential issues related to privacy, but also related to the inequities we know in the ability of people to get access to the vaccines. But certain companies are probably going to require proof of vaccination for certain activities. And, I think people should think about this as not just not a privilege of being able to do things because you're able to get the vaccine, but knowing that doing those things is going to be safer for you and for those around you if as many people as possible will step up and get vaccinated. We're at a critical time point, I think, over the next 4 to 6 weeks as we see cases start to rise a little bit. At the same time, we're seeing record numbers of vaccinations. We had a 24-hour period with 4 million people getting vaccinated, which is just incredible over the past weekend. But we still have a little bit of ways to go before we have enough people vaccinated, enough people with immunity from prior infection where the majority of people are going to be safe from COVID. We're not there yet.
And Doctor, on the issue of travel, we had the CDC come out and say that cruise ships won't necessarily have to require proof of vaccinations in order to resume sailings. But I wonder, at what point would you feel comfortable enough to resume, for example, cruise lines and their travel without a vaccination proof in place? Are we talking about the point where we actually reach herd immunity? How are you thinking about that?
Well, I think for me and my own, personal travels, until my children get vaccinated, we're not going to be doing, any travel like that on airlines or cruise ships because I want to make sure that my kids are protected. Hopefully that will be happening fairly soon. My kids are both over the age of 12, and Pfizer just released some preliminary results showing that, in a trial of about 2,200 adolescents between 12 and 15, their vaccine was safe and it was highly effective at preventing symptomatic disease and also created a very robust immune response. So I think for my own personal life, we're not going to be considering any of those types of activities until our kids get vaccinated. And I think people should also think about, as they're booking travel, understanding where they're going, what's happening in their local community, what's happening in the world. If they're going on a cruise ship, where's the cruise ship going? Who's going to be on it? What are the ports of call? I would be a little bit hesitant right now to get on a cruise ship with a bunch of unvaccinated people because, the potential for an outbreak would be fairly high with a number of circulating cases that are still happening in the community. While things are getting better, certainly than they were at some of the peaks in the U.S., there's still a high level of circulating virus in the U.S., but also around the world. Now is, I think a critical time to be really considering your behaviors, trying to get vaccinated if you're eligible, and thinking really carefully about the types of activities you're going to be engaging in as an individual or with your family and friends.
Yeah, and it's obviously going to be a lot of personal decisions out there in terms of what people feel comfortable getting back to. But in terms of maybe beyond the personal decisions, we are seeing vaccine passports at least get put into place in terms of IATA's vaccine passport going to be able to be used for travelers going to Singapore. But there was a lot of chatter about how far would be too far in using passports for something like that versus going to dine at a restaurant, maybe on the extreme front, going anywhere. So how far is too far in your mind when it comes to a way of looking at this within the medical community of maybe why we wouldn't need passports for everything when we get back to normal?
Well, I think there are lots of issues that we have to deal with. First and foremost, we don't have a system yet that exists that would be able to actually have accurate information for people to share across the entire country. So building that system and building it in a way that protects people's privacy is going to be an important concern and something that I know a number of companies, including the government, are looking into. We also have to look at access to vaccines, right? There are still large swaths of our population who medically would be eligible but are not getting access to vaccines as quickly as we would hope, and the uptake in certain communities has not been as high as we would like. And so I think we need to look at the implications of putting policies in place when we do have people who want to get vaccinated, who have not been able to get vaccinated, or who are not lining up to get vaccinated because there's been misinformation and they don't understand the potential health benefits of it. So I think those issues need to be tackled before we can really talk about, how far can we go with a mandate. I don't think in our country we're going to have a federal mandate to get a vaccine to do certain activities, but I do think we'll start to see certain businesses consider, what would be appropriate in order to make dining or make certain travel as safe as possible for everybody. And that's going to change over time. Those calculations change over time when we start seeing, hopefully, a decline in cases across the U.S. and across the world as a larger number of people get vaccinated, but we're not there yet.
And Doctor, there's some quality control issues or questions raised about Johnson & Johnson's production there. The company, of course, taking over the production of this Baltimore facility that was run by the company Emergent Biosolutions. There's already a lot of people who are hesitant about getting the vaccine, concerned about its safety. What do you tell those who are looking at some of these headlines coming out of J&J about how they should be approaching and how comfortable they should feel getting that actual dose?
Well, I'd be comfortable knowing that there are quality control measures in place that pick this up, right? I mean, while we would hope that all the batches would be, up to the highest quality, there are these procedures in place to make sure that if there is an error in manufacturing, it gets picked up before it gets into an actual vaccine that goes to the public. So I would tell people that as far as we know, the vaccine is safe, the one that's reaching the public. We haven't had any issues with an increased safety signal with either Johnson & Johnson or any of the available vaccines that are circulating in the United States. So I would be comfortable that if you're signed up for a vaccine dose, that the dose you're going to get is going to be a safe dose and it's going to be effective for you.
Johns Hopkins Biocontainment Unit Medical Director, Dr. Brian Garibaldi. Always love having you on. Thanks again for chatting.